very concerning because we don't need to have another epidemic.
Could Northeast Ohio be on the brink of yet another drug epidemic? Just like the opioid crisis, this all starts with a prescription.
And Only News 5's Tracy Carlos talked to federal drug agents about their new focus.
Yeah, Rob, Danita, the DEA is now worried about an emerging trend with stimulants. This warning coming from the DEA diversion unit that focuses on pharmaceutical drugs.
So over the last 8 years, things have quadrupled in how many people are getting stimulants.
Those numbers grab the attention of DEA Diversion Program Director Kathy Federico, and she is concerned.
When you see those types of increases, you wonder what's happening out there. And when we start looking at the ORS data, again, our state prescription monitoring program data, you see the opioids decreasing, you see benzodiazepines decreasing, which are products that are being abused, but the stimulants are on the rise.
The number of doses dispensed at Cuyahoga County pharmacies is shocking at nearly 13 million in 2018. Cuyahoga County ranks number 2, just behind Franklin County. Hamilton, Lucas, and Butler round out the top 5 counties.
Most of the products that are out there that are being abused are your medications for either weight loss or ADHD.
Stimulants are often prescribed to treat ADHD.
It's concerning that the amount of stimulants that are prescribed out there is certainly increasing, and that these medications have risks.
Cleveland Clinic Dr. Jess Levy specializes in child and adolescent behavioral health. He is not surprised by the emerging trend. He prescribes stimulants to treat some ADHD patients, but told me there needs to be more education aimed at parents, patients, and providers to prevent abuse and misuse of the drugs.
If we suspect that a child is using the medication inappropriately, we suspect that there's drug abuse going on, we suspect that maybe the medication is being sold or given to somebody who it's not prescribed to, we have to take that seriously and take immediate action to keep the child safe.
DEA research shows stimulants are being abused most by those between the ages of 18 and 25. Federico told me college kids are popping pills for more energy and to stay awake. The DEA fears we could be on the brink of another opioid-like epidemic.
Right now in Ohio, we're seeing an increase in cocaine and methamphetamine, and on the illegal side. So on the legal side, we're seeing the increase in the stimulants also. So it's following the same pattern.
Now, the DEA told me there are 2 arms to their diversion unit, enforcement and education. And Rob and Danita, they told me that they will be using both to try to stop history from repeating itself and having a stimulant epidemic.